to advance our farm-to-fork food system. So how this all came about, the Kansas Rural Center has been working in local food systems development practically since its inception. They've always recognized the importance of a local and regional community food system. And so in Kansas have always seen the need to really rebuild or build that system. So there have been a lot of projects and a lot of work over the years, and a lot of that work is on the ground with farmers. You've heard about the Rolling Prairie CSA, where Joy Babominska and Paul Johnson and a lot of other farmers in Northeast Kansas were real pioneers in the multi-farm CSA movement, and they still have that Rolling Prairie CSA operating today. The Rural Center has been instrumental in the quadrupling of farmers markets across our state in the past 30 years since we've been around. So a lot of practical work on the ground to provide farmers with marketing options and consumers with local food options and the ability to have a healthy food ecosystem in our own state. Core to the mission of the Rural Center is advocacy. So we recognize the need for that on-the-ground education with farmers, but also research to really understand what the farmers need, and then also advocacy to ensure that the policy level, the laws, the people implementing them, really support the needs of farmers. So when you're looking at local food, over the years we've done a lot of analyses and studies and various attempts to advance the system. That culminates in this project. This project is a 3-year initiative with the Kansas Health Foundation called the statewide, Sarah, what's the name of it?
Statewide Partnerships for a Healthier Kansas.
Statewide Partnerships for a Healthier Kansas, thank you. So we are one of 5 statewide partners. The others are the American Heart Association, who now have launched the, I'm never going to get this.
Kansas Alliance for Wellness.
Kansas Alliance for Wellness. The Kansas Hospitals Foundation, what's that?
Yes.
Yeah. Kansas Action for Children and Casey Healthy Kids and the Kansas Rural Center. So our 5 organizations are working for 3 years to make healthy foods the easy, the affordable, accessible choice for Kansans. So our role in this is to say, how can our farms be part of this? If you want more healthful foods accessible to more Kansans, it would make sense if we're in Kansas that our farms would be part of that. So we're tackling this little part of that. And the goal has been to engage with Kansans on the grassroots to really understand the state of our farm-to-fork food system and what is needed to grow it to that level where farmers can really meaningfully engage in helping feed our neighbors. So the process we undertook to get here was the one that we've been talking about in this conference. It's an adaptive leadership, leading from behind, listening, communication, whatever you want to call it. But really it's about engaging with communities, in communities, to spur community dialogue and understand maybe deeper level what the systemic issues are, and then have community members working to come up with solutions. And through the process, we've listened. And Cole Cotton has collected reams of paper of listening to their notes. So over the past year, we've had 4 community meetings around the state. We had one large regional meeting at Newton, and we started the whole thing with a small group of what we call our statewide partners in Topeka, many of whom are in this room. So the statewide partners were really the people at the state level who have been working on these issues for a long time in our agencies. So our Department of Agriculture, Department of Education, those folks gathered and kind of set a structure of what they're seeing from the top in terms of the farm-to-fork food system. The regional partners at Newton then gathered in a room a lot like this and workshopped around tables for a day to put some framework to what are the real issues in getting food from the farm to the fork. And then when we went out to the communities, they really put a lot of flesh on the bones and talked at the basic level what they're dealing with in their region. And then Cole put that together with the help of some attorneys who really looked at our laws and laws from across the country, what's worked, what hasn't, what's effective, what's not. And also did a very thorough literature review to see what has gone before, so we're not covering the same territory again. We're advancing the questions, and basically boiled it all down together into a report. Now, we in nonprofit land, here's the statewide partners up top at work, and then here were some of the regional partners at work in Newton. We really worked at these meetings. These were really hard-working meetings. We went home exhausted. But we did put together a framework to advance the system. The thing about projects like this is a lot of the time that report then goes on a shelf. So what's different about this project is we know what we need to do, and we have 7 very definitive recommendations that every Kansan can engage in to make this happen within 2 years. So now we have 2 years to make it reality, and that's where all of you come in. So our goal today is to engage you with what we have really consolidated down into the 7 most important recommendations in the state to advance this system. And then we wanted to spend the rest of the session, a good portion of it, brainstorming with all of you what you would need to be able to advocate for this in your community or with your legislators, or where you could take it. So we kind of want to hear from you in terms of, from here, what ideas do you have? What more could you use in terms of support materials or whatever that may be? So that's kind of the background of how this came to be. Did I forget anything? Oh, yeah, other states have done this. So as we've worked over the years, and Paul Johnson has been really instrumental in leading the way to say other states have done this. We don't have to reinvent the wheel. Let's look at what they did, and they've made differences in their states by doing this very process where they've engaged people from all walks of their communities to come up with a really targeted plan, a really strategic plan. So some of the ones we really look to, because the conditions are very similar, were Iowa and North Carolina. And then the Oregon Feast was important to us because that's the Oregon Food Bank. And when they were looking at food access issues, they discovered farms to be very critical to the conversation. And we became familiar with Feast because the Rural Grocery Initiative out of K-State, on which we were partners, brought Feast to Kansas and trained some of us in how to do it. And it's really a community facilitation, as I was saying, just a dialogue to get communities engaged in their own problems and come up with their own solutions. So we brought the Feast idea in, we modified it a little bit for Kansas, and that was really the other model. From there, I'm going to turn it over to Cole, who's going to walk you through the findings and the recommendations.
Julie has offered that I could sit my tremendous body down. I have a small child I'm hauling around today.
Are you going up here?
I think I'm going to stand up here and then I can lean. Is that possible?
Then I'm gonna go down here.
I hope I don't break anything. Hi, I'm Cole Cotton. I'm with the Kansas Rural Center. And I had the tremendous fun of spending the year with these ladies and a whole bunch of other really awesome Kansans. Yes, Natalie should stand up also. Natalie's our lead coordinator of this Community Food Solutions project. She's our fearless leader who has made the whole thing come together and been the glue and the, what else do you say? She keeps it fluid.
Cement and everything.
Rubber cement. She's been the rubber cement for the whole thing. Anyway, I'm here to tell you a story, and the cover of that story is pretty. There it is. We're really proud of it. We're really excited to release it to you today. Miss Vanna Natalie has some executive summaries that she can share with all of you today. But I'm going to delve into some of the details that are in the report, and every person who came to this conference will get an email, as has been stated, that has some different things in it, and one of those will be a link to the full report for those who want to read it. You'll have to pardon my panting. I'm also breathing for 2. So the story, is this thing on? Okay. The story is a story of making healthful foods the routine, easy choice by employing a very seemingly common sense solution, which is to look to our farms, the source of our food, as a critical part of trying to increase the availability and accessibility and utilization of healthful foods in Kansas. Agricultural heritage is a huge part of Kansas, and we do address that in this report in a few different places. And I think we've heard it across both days that it can't just be an individual effort, and that this is all about bringing people together. So the process, sorry, not yet. The process that we've engaged has been bringing people together, but it needs to continue, and a lot of the recommendations in this report actually really speak to formalizing some relationships that continue to pull people together in a strategic way to work on some of the issues that we bring up. So we make the point that our lives, our communities, and our economic prospects for the future depend on addressing these critical issues. That engaging our own farms and feeding our own people is a way to potentially improve not only our health, but also our economy, our communities, and our environment in this state. And as Julie said, we're not the only state to have found this through our assessment. It's actually been found globally in other similar assessments. So I don't know if this is appropriate to bring up. Bob Dixon said something that really struck me, which is that a disaster is a tremendous opportunity. And I hearkened, we don't use that word in the report, but really we are facing a serious crisis in the way that we're consuming foods and the way that it's impacting our health. And if you want to apply that word, I think we can also look at it as an opportunity here in Kansas, and that's how we try and approach this here. Ricardo also talked about the costs of the imbalance of our production and the imbalance of our consumption to our society, and so all those things are interwoven here. That was my little introduction. So your executive summary that did everybody get one? Should already have, gives a little introduction into all of that. Dan, you can show the table of contents here. So this is the table of contents for the whole guide, and what you have is that very first section on top there, the executive summary, which includes a focused introduction and a little background on the project, the summary of the assessment, and then a very brief look at the recommendations. And the meat of the recommendations is in the report that we'll email you, and I'll go over that a little bit. So I'm going to basically go down the table of contents through the contents, and I'm going to save the recommendations for the end. You've got your sneak peek now to what the conclusion of my story is, but I'll get into a little more detail about that. So we introduce this, as you can see there, by pointing out that distance and economic factors limit access to healthy foods for people in all 105 Kansas counties. And so when we're talking about food access issues, we're really talking about all of us. And if we add on the issue of actually consuming those healthful foods that are or are not available to us, then we're looking at 92% of Kansans who, in 2010, according to Healthy Eating Index survey, were not consuming a nutritionally balanced diet. So pretty significant numbers, and I think we can all relate to them. So in our state, we're a huge agricultural state. It's a core part of our economy. We pride ourselves in feeding the world, but we also currently struggle to feed ourselves and nourish ourselves adequately. This report looks at increasing the consumption of healthful foods raised by Kansans for Kansans as a significant way to impact our health and our economy, and it draws on the interconnectedness of those things. Some key statistical highlights. The majority of the state's food dollars, more than 90%, are spent on food from outside of Kansas, despite the fact that we have such a strong agricultural economy. And if we were to just take $5 of our food and apply it to our local farms, we would see an increase of about $750 million in new revenue for those farms in Kansas. We'll touch on the economic story a little bit and really point out, as it's been said earlier, that farms are among those who are challenged with these issues that we're talking about today. So farm to fork is a phrase that we throw around a lot, and just to be specific, what we mean is looking, when we say farm to fork food system, we're talking about a system that incorporates our Kansas farms into the supply chain that provides healthful food to Kansans. Breathing. One of the other key actions that we're calling for is more partnerships and greater leadership, not just among communities, but among policymakers and between communities and policymakers. And so you'll see that reflected in the recommendations. And the recommendations focus on policy, and policy is like the nasty P word. In communities across the state, it's not like super attractive to say, hey guys, let's have a meeting and talk about policy, wee. But it's true that it's important. Lasting change can occur at the policy level, and we explain this in your summary there by saying, when we change our public policy environment, we codify those changes that we make, enabling them to be sustained over the long term. So putting them in writing is a key part of this. And then engaging community in that process of putting them in writing, make sure that they're applicable and that there's buy-in and there's support. So the only other thing I wanted to draw on from this sort of narrative in your executive summary is that you'll notice in those recommendations that 5 out of 7 of them focus on fruits and vegetables. And we want to be really clear that fruits and vegetables are not the only part of a balanced diet. In fact, if you only eat fruits and vegetables, you'll probably be in big trouble health-wise. However, we know through this assessment and in general that in Kansas we are overproducing and overconsuming. The others compared to fruits and vegetables should look at fruits and vegetables as being underproduced, underconsumed pretty significantly. And we'll look at some of those statistics, and that is why we're looking at kind of filling that gap and need. That's not to negate the other needs, and you'll see on the little table there that we have a whole bunch of appendices that I'll just briefly touch on, but you can look at, and there's one of them called Needs and Opportunities that says, these 7 priorities that we've selected are about immediate impact and immediate possibility for change, things that we know are possible right now to begin impacting the system, and a lot of it is formalizing those relationships that will create those whole system benefits. Okay, I'm getting tangential. What's my next slide, anyway? Oh, hey, that's what I've just been talking about. That's lettuce that my husband and I grew. Okay, healthful foods, thank you. Healthful foods, when we're talking about those, we mean fruits and vegetables, we mean whole grains, and we're talking about a diversity of protein sources. So we've seen lots of little graphics of what healthful foods are, and ours is the simplest of all, and we're just going to keep it that way. What else you got there? All right, this is a little graphic of the food system. It's probably really hard to see, and I, in fact, can't even see it from where I'm standing, but basically it's, the food system, when we talk about food system, we're talking about all those different activities and players that take the food from soil to seed to through the production process, but then also through transportation, through processing, down to the outlet that it's sold through or directly to the consumer, and even back through the waste process. So systems is a word that we use heavily in this report because we can't just look at one of those to address the whole issue of trying to feed ourselves and feed Kansas. All right. So the premise of this report, what is my next slide? Just curious. Okay, back up, please. Thanks. The premise of this report is that we have inadequate access and we have insufficient consumption, that we're not consuming a healthful foods diet on the basis that we should, and that these are critical issues that provide an opportunity for us to reevaluate how we set up our society in Kansas, locally, regionally, and statewide. And we identify 4 key barriers that you'll see, and these 4 key barriers that are in your executive summary, it should appear on the bottom of page 5 there. Those are the 4 that our recommendations are really trying to respond to. These are things that really rose to the top repeatedly across all our meetings across Kansas. So key barriers currently limiting the capacity of Kansas farmers to provide a diverse selection of healthful foods direct to Kansans. The first one was inadequate local and state level coordination, planning, and resource allocation to support and sustain that farm-to-fork food system. Lack of regulatory clarity in regards to state level policies that impact the farm-to-fork food system. Lack of a central location for finding farm-to-fork related policy and program information. Across government and non-government sectors, just again, this need to pull together and coordinate a little better. And then the limited information resources and protections for the production, handling, and sale of fruit and vegetable crops in Kansas with our unique conditions. So that's like a super abbreviated version of what's in the report, and each of those bullets gets its own several paragraphs. I'm not going to talk about recommendations right now because I wanted to highlight a few other things in the report before we do talk about that, but I think Julie made clear our goal. I haven't started timing myself. I'll just go as fast as possible. But our goal is to save as much time as possible for the dialogue because it's really beneficial for us to hear what your reactions are to what you've heard, to continue to build on this iterative process of gathering information. And really, our next step, now that this communication is out there, what we found so far, is to really push towards action and to get help from all of you and from those that you're connected with and from those we're already connected with in identifying those key ways that we can advance these things between now and July 2016. So, tight timeline. Next slide. This is the overarching vision that we pulled people together in. And there's a section in the report that talks in specific about the vision that came when we presented this overarching vision. So this came from us. We said that we envision a Kansas food and farming system that will increase our residents' access to and consumption of fruits, vegetables, whole grains, and a variety of protein sources, both at home and in food outlets. Go ahead. So when you read the report, you'll see there's a section about what the food system will be driven by, who are going to be the key players, its producers, its policymakers, et cetera, and it gets pretty specific. And then the next slide. This is the Kansas farm and food system will make diverse, healthful foods increasingly available, accessible, and utilized in these different ways. And again, this is all rising up from conversations and hundreds of pages of notes that I got to work and rework to find the key themes. So go right ahead, Dan. That's the vision section. There's an extensive methodology section. Julie's really gone over that pretty well. So I'm going to skip that, skip this. And now this here is the beginning of the actual assessment communication that we have. So you guys have a summary of the assessment that I basically just went over, but I wanted to show some pretty pictures and kind of highlight some of the mapping of what we're talking about. So the light pink areas here represent the 92% of Kansas counties that face limited physical availability of healthful food. That means that these counties in light pink have 10 miles or more in rural areas and 1 mile or more in urban areas that they have to travel to get to a healthful food source. And then the dark pink areas are areas, there are 25% of those counties where transportation also compounds that issue, that a significant part of the population actually even with those distances lacks transportation in general. Go ahead with the next slide. So, oh, I'm sorry, please go back. So just to touch, earlier when Julie was talking, she said, you know, in a lot of these towns, trucks don't even stop. They're just driving on by. We found through the Rural Grocery Initiative at K-State University's studies that in the 5-year period between 2007 and 2012, 82 of the 213 supermarkets in communities with populations of less than 2,500 in Kansas closed their doors, 82 out of 213 in that 5-year period, and that continues. Also in that same year, in 2012, only 51% of Kansas's 675 cities had a supermarket. So if we're talking about finding healthful foods, the convenience store is not where I typically go to buy my salad mix or my radishes or my carrots or even my bananas, actually, because as the report will say, bananas typically are about 4 times more expensive or more when you go to a convenience store versus a supermarket. So those numbers are significant, and the report talks about that a little bit. The other thing is that in those areas where there's not those supermarkets, we could even term them food swamps, because these are areas where we find there's ample supply being channeled of these nutrient-poor, calorie-dense, high-processed foods. So I'm probably not telling you anything you know, but just telling you what's in the assessment. And then the next slide demonstrates this other issue. So we're talking about physical access, but then imagine physical access challenges compounded by low income. So these are the tracks where you already saw the physical access issues. Now we have low income in 51% of Kansas counties with physical availability issues. Low income is also compounding that. So there's a map of that. In the next section, we've got a little map of poverty here, and I wanted to slip, just to put that word out there, and then to give us an idea of what we're talking about when we talk about poverty and the you know, what level of poverty is and who we offer assistance to and how much money they're making. So here's a map of the most extreme poverty in Kansas, being the dark red areas. If you go to the next slide. This just gives you some numbers, which you may not be able to read, but you know, for myself, for example, a family, about to be a family of 4, I would need to try and figure out how to feed my family off of $23,550 a year, or for an individual, $11,490. A lot of these folks are working very hard. The report kind of goes into some of the different systems that are there to support people who are at that level of poverty or a little bit higher. So food assistance for my size family about to be would be about $500 shy of $30,000 a year. Those folks have access to food stamps, and those can be used for local food in some areas, and the report talks about the possibilities there, and they are advancing with help of a lot of state systems. And then we also have a few other programs that hit the 185 mark, which would be my family surviving off of $43,000 a year. So just wanted to put those numbers out there, I guess, to make it a little bit more personal, that, you know, if we imagine the struggles that we have affording healthy food in our current society and accessing them, those are some of the income issues. So the last thing I wanted to say before moving on to the use part, and then we'll move into agriculture, is that stigma was really identified as the people that we spoke with across Kansas identified stigma as the #1 issue keeping people from accessing these services. And Kansas actually has an embarrassingly low rate of participation in food assistance services. So we really heard that pretty seriously. That stigma, that's people, you know, having a negative perception of low-income people or folks who are asking for food assistance, who are struggling to feed their families anything, let alone something healthful. So those are just some of the issues that those whole systems approaches will have to have in mind as we continue to advance the solutions here in Kansas. So the next slide. Now we're on to utilization. This handy graphic comes from the Kansas Leadership Center, but it captures a 2010 survey by the Kansas Health Institute that, like I said, identifies that less than 8%, technically 7.7% of Kansans consume what would be considered a balanced diet. When we're talking about fruits and vegetables, in 2009, a survey found that less than 25% of Kansans consumed enough fruits and vegetables, or the recommended daily amount. So obesity was talked about earlier, and there was like a really big belly and the billions of dollars, I think it was $1.9 billion that it costs to care for the health